you have problems with, you said your cervical spine, is it like low neck or like upper?
Right in here. That's
Right in there?
Yeah.
The way that I'm first going to work on this is I'm going to come in and go, hey, if I pull down this way, where do you feel that? This is me establishing contact, because how do the clients feel when I come in and do this?
What are you doing?
Yeah, could be.
No, she feels safe.
And I hook here and go, listen, how's that? So you feel it like where my hand is, you said, and then up.
Yeah, right about.
Is it kind of pulling through that neck stuff?
Yeah, and right up here.
I think in video, sometimes the stuff looks inordinately boring. Massage therapists think I'm working on the shoulder, because you can only work where your hands are.
That's true.
And I'm tense through the spine, so I feel a lot of twisting movement.
She knows she's not going to fall off the table because I've established this passive body contact, and I can just lean. This is just me pulling, but do you see this little cervical rotation she's going through? This little bit of movement? When I pull, do you prefer down, like towards your feet, or back?
Back.
Right
And
there?
I'm feeling that. Oh, you're popping stuff.
I'm popping stuff.
Yeah.
She had a spontaneous cavitation. How's that right there? Do you prefer the rocking or static?
Rocking.
When you say you prefer, are you saying that's
Actually,
doing
it's
more?
pulling a little less physically on the skin.
Okay.
And I'm feeling a little more, when you're doing the pop, it's kind of an ease and pull, ease and pull. Yeah. Oh my God.
Shoulder feel better?
Yeah.
Spontaneous cavitation. I guarantee the mic picked that one up. That was her shoulder joint. I wasn't even really thinking shoulder joint. I'm mobilizing the shoulder girdle to mobilize her upper thoracic into her cervical spine. When I pull down like this, and this is something we have to be real clear about. It's a real simple move. Let me see what I got set up here. No. Yeah, so we're open up pec and pec minor. It's in the front, right? Mm-hmm. When I'm pulling back, what I'm really doing is lengthening pec and pec minor. I'm pulling those muscles open. When I dealt with women, what was most interesting was breast tissue fell down and forward. I was up here underneath the arm, but it didn't feel untoward in any way at all. Like their notion of what was going on was very different. It gets into the neck because as I'm pulling down and her head would lift, it would start to lengthen some of the cervical paraspinals, right? But then it's also lengthening levator scapula. It elevates the scapula, lifts the shoulder blade, and she's pointing on my back saying she felt it in my mid-thoracic. Right in there. The issue is it's also lengthening the upper trap from origin to insertion, because muscles cause movement, and I'm using movement to assess where she's having a problem. Take off your shoes and lay down on the table so I can assess. Do they want to hear that? Do they even know what assessment is?
Sounds intrusive almost.
Well, we're going to manipulate soft tissue today. Do they want to hear that? I say, hey, listen, take off your shoes, lay down on the table. I want to move you around to see where we're going to work. Just that. I only really did one thing. I kind of tractioned your arm first just to see, okay, is that uncomfortable? No? All right. Then I went into something that's a little more intimate where I sit pretty much at your sacrum. I'll put my leg on the table. And then when I hook under, I'm going to start to roll the pec open, lengthen trapezius, levator scapula. And I was giving her a choice. Does she want to go down or does she want to go back? Or maybe it's a combination. Maybe it's 45 degrees. Like a little, she is literally rolling onto my leg here. She had that clunk through her shoulder. Now stand up for me. What does that right shoulder feel like compared to the left?
It feels like it's down a lot more than this one.
How many times did I use my hands to push on her? Western effleurage based massage and deep tissue is push. Whereas Thai massage did this crazy thing where I felt like it was more balanced between push and pull.
What about on this side where it is broken? There you can see it pretty good.
Do exactly the same thing. I'd be more gentle, and I'd ask for way more feedback, because she'll tell, if anything's uncomfortable, she'll tell me. I didn't know I was pulling on skin. She told me that verbally. That's the danger if you're doing chronic pain stuff. If you're not communicating with them, they don't really know what they should be telling us. We have to ask the more pointed question. Does that make sense? I want you guys just to give and receive that one piece, and then I want feedback from the receivers on like how their upper back and neck feels just from that.